Hey friend, welcome back to Real Talk with Nursing Outside the Box. My name is Donnie Alvarenga and I have Jessica, Shelley, and Todd with me for us to talk to you today about some real stuff. Today, this week actually, is National Obesity Care Week. And the whole topic of obesity and overweight is something that's near and dear to each one of our hearts for one reason or another. And it's such a, what's the word I'm looking for? There's opposing views on so much of it, right? From the fact that it's now a diagnosis to how do you treat it properly and what is the best way and so many different things. So where are we going to start this conversation today, guys? Where are we going to dive in?
I was just listening to you share, and I have to do this, is like, who made this week National Obesity Week? And like, it seems like every day or every week there's like national, like, underwear on your head day week or something. What made this week that week? You know what I mean?
That's a great question that I'm not quite sure the answer of, but do you think that there's value in having a week dedicated to talking about, it's not National Obesity Week, that's another week of the year. This is National Obesity Care Week, which is how do you address the issue of obesity, right? Do you think that there's value in having a week designated to, just bringing national awareness to it?
Honestly,
I think we're pretty aware.
Yeah, I'm not
Majority
sure
of us are overweight.
Yeah.
What were you going to say, Jessica?
I'm not completely sure that I see value in assigning a specific week to anything, because the overall picture is this is not a 1 week topic. This is a topic that should be addressed daily, right? It's a topic that is really creating a major problem in our society. And I'm going to take it more from the coaching view rather than like the physical view. I was listening to a podcast a couple of months back, and it was this couple that worked with people who were overweight, right? And they had an exercise program and a nutrition program. It was like a Biggest Loser type program. And what he said really pinged my heart, because he said, when I look at every single one of you, I don't see 50, 100, 200 pounds of fat, of overweight. I see 50, 100, 200 pounds of broken promises to yourself. And I think that from the coaching perspective, that opens a way bigger picture of it's not about the food. Because if it were just about the food, every single one of us would be healthy because our bodies ask for nutrient-dense food. It is about that underlying mental process, those ineffective relationships with food, that ineffective coping mechanism for big feelings, right? And honestly, in my opinion, I really think that that's really the root of what's going on with obesity. So like saying, how do we care for it? Like, I think it's way more like you need that support for somebody that can get into your heart and can hear your heart and help you start healing those places inside that are hurting before we can address the food.
So what you're saying is that food has something to do with the problem.
Oh, absolutely. Absolutely.
You don't get heavy by not eating. You know what I mean? It's kind of clear on that. And yeah, I agree with Jess. It's like, broken promises. I was just sitting here reflecting, like, I'll throw my age out here. I'm in my late 40s, right? And like, I could count on one hand, like 3 people when I grew up that were a little overweight, right? And now it seems like a majority or a good chunk of people are. And I think one of the things that, that I think is that we have to just start getting honest that we have a problem. That's like the biggest thing. Like, we do truth bombs and all that stuff. It's like, you know, there's a lot of political correctness around like, hey, you know, let's make this a clinical diagnosis. Let's use these terms clinically. We don't want to offend anybody. And, you know, I have to say, in challenging times in my life, like I'm not perfect by any stretch of the imagination. But, you know, if it hurts, it needs to hurt for me to want to do something about it. So I can't be super sensitive about it. I got issues like getting on. And if so, you know, all of those things need to be accounted for. But I do think people should not be just caring about it for a day or a week, obesity care. What about the rest of the 51 weeks of the year that people should be concerned about their, you know, weight and health and all of those things? So that's
I completely agree. You know, why make it just 1 week? But at the same time, I also think that there is value to having a week to bring focus to it, because I grew up in a family where I could maybe count one or two that didn't have any trouble with their weight. Everybody had trouble with their weight, and it was not something that was okay to talk about. It was not okay to talk about that elephant in the room, right? It was not okay to talk about, ooh, do you need to eat another piece of that, right? And it's interesting because I was watching one of my cousins in Brazil that was not part of this. You know, they were at healthy weights and so forth. And I was watching them recently, and I think his daughter took a piece of bread and she went back for a second piece. He said, no, you don't need a second one. And immediately I cringed, right? Because I was like, who is he to tell someone else what they should or shouldn't do? But this is the thing, is he was being a very responsible parent and teaching his daughter, but this is not something that was okay to talk about in my immediate world, okay? It was absolutely taboo. And yet it's interesting because coming from a Brazilian background, okay, it's very interesting because Brazilians are very okay with talking about weight in a very shameful way, okay? And one time we went to a church that I grew up in, but my husband had never been to. Mind you, he was about 100 pounds overweight. And this woman walked up to him thinking he was my brother and rubbed his belly. And she said, my, how you've grown. Can you imagine that happening here in the States, just in a random place? Somebody walking up to you to rub your belly and you're not pregnant and you're a man, okay? This is the type of thing that, you know, in a Brazilian culture is acceptable, okay? And that I had, you know, kind of grew up thinking, you know, it was a sensitive topic. And yet, so I like the idea of there having a week where we can come and have real talk about it, okay? It is a problem. So how do we speak to it in a way that people like me that need to address it, right, don't cringe and shy away because we were taught this is not something we talk about?
Well,
How do we do that?
I did a webinar a while back called It's Not Your Fault You're Fat. And it spoke to the fact that obesity is a major risk factor for early mortality and death. And I think that if there's something that's that powerful, that is killing so many people and disabling so many people at such a young age, we need to talk about it. I mean, we have no qualms about talking about drug awareness or, you know, talking about that, you know, drugs are obviously not healthy and the risk of them. But how often do you ever talk to children about the risk of obesity? I mean, I just read an article the other day about a kid who went blind from eating fast food every day. I mean, that's a risk. And I'm sitting here looking at the risks and the leading causes of death from the CDC in 2017. The 10 leading causes of death are heart disease, okay, cancer, obesity related. About 20% of cancers could be prevented through healthy weight management, as well as about 80% of heart disease. Not all, but that's a pretty good portion. Another one is stroke. Again, high blood pressure, you know, coronary artery disease, Alzheimer's disease, which is now thought of as, some researchers are thinking of it as type 3 diabetes, kidney disease, which again can be related to obesity. And there's others that are, I wouldn't say they're directly related to obesity, but that's a problem. That's a problem. And your doctor's not allowed to talk to you about it because he doesn't want to offend you. You know, your pastor's not allowed to talk to you about it because he might offend you. Your friend ain't allowed to talk to you about it because, you know, you're supposed to have body positivity and, you know, you're supposed to love yourself and all your stuff. I'm sorry. I'm not loving my friends to cancer, heart disease, or strokes, or Alzheimer's, or diabetes. I'm just not that kind of girl.
Yeah.
So this is the thing, is that I agree with you 100%, and that's my huge passion surrounding health coaching and lifestyle modification, is that I understand how challenging it can be to fight those demons and to, you know, the whole you don't want to offend somebody, right? I understand that, but I have seen the very, very real negative, deadly consequences. And so I've been trying for the past many years to marry the two. How do we talk about the seriousness of this, okay, while not offending people, right? How can we address the fact that this is dangerous and bypass all the biases and all of the self-worth, right? Issues that come.
I'm really not sure that there is a way to do that. And honestly, I totally agree with what Todd says, is that when somebody says something to me that hurts, it's probably because it needs to hurt. And if I'm not even willing to express that, like, ouch, that hurts, and I'm not willing to have that awareness, then how am I going to be able to start shifting that, right? And it's the same for, like, my friends, my family, my clients. I'm with Shelly. Like, I'm not going to love you into heart disease when I love you so much and I have the tools to help love and support you. And I think really the message here is not like, how can I say that without offending you? It's like, I'm going to say it in love and without judgment, knowing that it's going to offend you because I love you so much. I'm willing to take the risk of offending you and poking that spot that hurts because I care about you and I want you to make a change. And honestly, I don't think that being derogatory and being like, look, you're disgusting and you're fat, like, that's certainly not the answer, because that doesn't help anybody. But saying, hey, I love you enough to ask you, do you really need that second piece of bread? Or to tell you, I don't think that you need that second piece of bread because I care enough about you to teach you good habits. I care about you enough to create a space where you're allowed to be offended, and I'm going to support you in love and compassion in that offense, and I'm going to help you heal that. And I really think that that's the answer, is creating that safe space for people to be vulnerable, because there is so much judgment around being fat or being addicted or, you know, any of those like taboo type subjects. And really tippy-toeing around that answer for fear of offense is not serving anybody. But creating that space where saying, I know this might offend you, but I love you so much that I'm willing to go there and I'm willing to hold space for you to help you heal.
I agree. You know, the interesting thing about all this is, like, you know, I had a guy once told me, he's a good friend of mine, and he made this comment and he goes, you know, when it hurts bad enough, you'll stop, you know, and sometimes it needs to hurt. Like, the challenge, you know, if we're getting around this obesity thing, it's an addiction, I think. You know, there's some addictive qualities here, right? Now, for alcoholics, they could abstain from alcohol, right? They don't need it to survive, right? But they also, you know, with food, you have to eat to survive. You can't really, you know, stop and say, hey, I'm going to go to a group. But, you know, how can, like, millions of alcoholics who are recovering be wrong when the first thing is say, hey, my name's so-and-so and I'm an alcoholic, right? The first step is admitting you have a problem and then circling around to starting to get a solution and working it out and a lot of shame-based stuff. And I think one of the things that I love about health coaching, and we're all clinicians, and I have to be honest with you, I'm dejected by the medical model. It's become a a microcosm of our American society where a physician needs to treat you, whatever it may be, with what the rule is according to the physician's right, wrong, or indifferent. And it's hey, and they don't often know what to do. So if they're overweight, they're like, oh, I'll send you to a nutritionist, which confuses people often because they're like, you got to do this and this, and they don't know where to start. They're confused, more confused than ever, and we've talked to people about it. Or they're making a referral for surgery, which is my personal passion, is talk to me before that happens. You know what I mean? Because there are so many risks, and I view it, and this is just me, it's a way to almost, surgically create you to make different habits that you could actually eat through. I call it eating through, by the way. All of these things, right? But that's my biggest pet peeve about this, is like, there's so many things and people are dejected, and all of us here help others and coach. And the biggest thing that I see that people don't have is they don't have a sense of hope, because there's so much stuff out there. I've tried this. I've eaten grapefruits 20 times a day. I stand on my head backwards and all this stuff. And all of a sudden the head, is whatever. And I'll tell you, people tell me, they lie to me up front, not because they're purposely lying. I'll be happy losing 20 pounds. Like, honestly, if you can, we'll help them get there easy in a month and a half. We're almost there. They're like, oh my God, I really wanted to lose like 70, right? That's what they say all the time because they never believe there's a solution. So that's like my soapbox with some caffeine on board.
Well, my experience in trying to treat obesity inside of healthcare, I ran a weight management program for kids, and the whole idea of getting reimbursed for the emotional and the support piece, okay, was very non-existent. And that created a huge barrier. Yet I tell you what, I attended a nurse practitioner dinner where they recommended a pill that people take that would cost them about $800 a month. And they recommend this pill, I'm not even going to say the name of it, for the rest of their lives, because they understand that obesity is a lifelong thing. Okay. And that is something that I think we need to talk about as well. Okay. There are dysfunctions that happen inside of our body where there's communicating hormones or whatever, where when somebody has struggled with their weight versus somebody that's never struggled with their weight, they're going to respond to things differently. Okay. And so therefore, I get it that it's a lifelong journey, but is the answer a pill for the rest of your life? And I love how Jessica talked about how the fact that there's unhealthy relationships that are going on, right? Whether it's an unhealthy relationship with ourselves, unhealthy relationship with food, unhealthy relationship with stress, whatever it is, we're looking for a way to buffer that discomfort, right? And what I have found that is incredibly powerful is community.
It's huge.
Incredibly powerful because it helps us heal. So instead of us pushing people somewhere where it hurts, we say, why don't you come here where we can help you heal? Let's create space for all of us to heal together and just feel each other's pain and understand that it does hurt. It hurts. And
you know what I like about community though, and I have to say this, is like if you read like some clinicians, psychotherapists in the past, like John Bradshaw, The Family, Healing the Shame That Binds You, because I believe all addiction is a shame-based disease, right? So he would comment on the movement of Alcoholics Anonymous on going to meetings and sharing. And sharing is not having somebody tell them, oh my God, it's going to be all right. Everyone just keeps quiet and they share, and that's it. And it's about the exposure, and the community is huge. Sharing wherever you're at with just sharing. Like, thanks for sharing. Cool. You know what I mean? That's huge, you know?
Now, were you say something, Shelley?
I was just going to say, I feel like obesity, there's a lot of similarities in addiction, and I do view it as as an addiction, but what's different about obesity from other addictions is that we're actually set up for these addictions from like childhood. And I think that's the difference, because your parents aren't giving you crack cocaine when you're 3 to reward you because you went pee on the potty or whatever, right? You're not going to the doctor and you get your shots and the doctor gives you a little hit of heroin because you did a good job getting your shots. This is what we do with sugar. This is what we do with food. And, you know, I always say, like, grandparents, like those little old grannies with those yummy pies, like they're the biggest drug pushers out there, right? Everybody is like, I can't tell grandma no, I can't do that, right? Because there's like all this feeling attached to it. And I think that's the difference. The other difference is it's the addiction that no one will recognize. So if you said, well, I'm sorry, I'm going to need some time off of work to deal with me, and I need to go to this place to get some healing, you know, or I need some support, or I need a coach, you know, because I want to get free from heroin, everybody be like, yeah, you need to do that. Like, you need to do what's good for you. You know, they're going to be cheering you on. But if you say that about your love affair with food, because really that's what addiction is. It's like this love affair that you have with the whatever it is that you're infatuated with. It's like a romance, right? And if you said you were going to go away and get some healing for your food addiction, people would be like, why? Like, just stop eating. Just stop eating. Eat less. Exercise more. That's the answer, right? Like, just get your food list off of Pinterest and eat the things, right? So easy. Like, I don't need help with that. That's really, in my opinion, one of the reasons why we have such an obesogenic culture, because 1, we're primed from childhood. 2, we're defensive about it, so nobody can say anything to us. You know, food is almost like a religion nowadays. Everybody's got their own church that they go to, their food church. And don't mess with their food church, because you know, you will start a war. The other thing is that's different about it. So we know that food hits the same centers in the brain as cocaine does, but we give it to 3-year-olds.
Yeah, bread is crack.
We plant it at the beginning of the checkouts, right? You got to walk through it. Now imagine if that was heroin, and you were a heroin addict, and you had to walk through the heroin every time you had to go to the grocery store to get food to stay alive, and every time you went to the gas station to get gas, and every time you went to grandma's house, grandma was like, here's some heroin. You should eat it. You should have some. It's going to be good for you. You don't like my heroin? Okay, this is what creates a problem. But the major problem is we're not understanding the danger and the risks associated. And I say that fast food is the new smoking, right? Fast food is the new smoking. And we would never give our kids cigarettes, but yet we give them, this. And I feel like that's what makes it so hard. The other thing is that most addictions you can hide. My brother suffered from addiction, and it took years for us to really understand the scope of how bad it was, right? The difference is with obesity, you wear your addiction on the outside. So there's no hiding it. So I think as far as that shame factor goes, I think there's an even higher sense of that going on because you wear it externally.
Like an alcoholic, right? They hit a bottom. They can be naked on their front lawn, face planted, and they're like, oh my God, that was it. I'm never doing this again. What's a bottom for obesity? And that's usually, like somebody who's done drugs or alcohol or something, they're like, oh my God, I was in a crack house at 3:00 and in the morning, and I'm like, holy cow, what am I doing to myself? What's the bottom for obesity? Like, I can't fit into a seat in the airline, or, you know, what is that point? Or does there need to be a point? Those are some questions I have when we talk about, hey, when's the switch turn on to say, man, I've had enough and I need to do something about it?
I think that the main takeaway is, you know, there's many different factors that play into obesity, right? It's the relationship with food, it's addiction, it's, you know, remembering granny's heroin pie, right? There's so many different things that play into it. But I think that the key element we need to remember is that we can do something about it. We can do something about it. And there's many different theories on what it is that you can do. But what we know is that it's behavioral. And I don't think that unless we address the behavior and whatever prompts that behavior, that there's ever going to be a lasting result, unless, of course, you want to take the $800 pill for the rest of your life, right? And put yourself at risk for necrotizing pancreatitis, okay? If you want to put yourself through that risk, then yes, by all means, take that pill. But what I'm saying, or what we're saying, is there is hope, okay? That yes, it is a lifelong journey. There is no simple solution, but it can be done. All four of us are health coaches. All four of us help people transform their lives. All four of us have experienced transformation in our own lives in one way or in another. And we've learned that it can be simple. Is that true?
100%. Honestly, like, I struggled with emotional eating for my whole life. And I'm not going to say that I don't still struggle sometimes, but I struggle way less than I used to. And the fact of the matter is, I had a safe space to say, hey, this is where it hurts. This is why I struggle. This is why I wear my pain on the outside in the form of fat, right? This is why. And I have a safe space to go and to have people in community and a coach who's got my side, who's willing to say, hey, thanks for sharing that hurt. I hear that hurt. I'm with you in this pain and I have a solution. Let's do it together. And I think that's really, at the end of the day, that's what it takes. We all just need a safe space to be able to share our pain and to have somebody who cares enough to say, I know that hurts. Let me help you.
I love that. I have goosebumps here listening to you, because isn't that the truth? I mean, that was just beautifully stated. And everybody has their pain wherever it is that hurts. But when it comes to changing behaviors, it can be challenging, but using a simple system, it doesn't have to be impossible, right? It can be possible. So, I mean, lots and lots of conversation today. Any final thoughts, guys?
Just know that you're loved. And there are 4 people right here on this screen that love you enough to be willing to open up that vulnerable space and to say, hey, you're hurting. Here's my hand.
Yeah. And that there's hope. You know, I think that people they've given up, you know, and, you know, I've watched more people have, after a week or two, their eyes light up, their voices light up when they're like, wow, this could actually work and there's a way. That's all I have to say about that.
We're going to say something, Shelly?
I was just going to say, you know, you may be listening to this and this may be a little offensive to you. You may be a little offended at the fact that we're comparing obesity and, you know, overeating to an addiction. And I would challenge you to ask yourself, what do you define as an addiction? I mean, if you can be addicted to video games, shopping, hoarding, you know, many different things. It doesn't have to be a drug, but, you know, I think what you said, Todd, was at what point does it become the bottom line, right? Where you're in so much pain that you're ready to change. And, you know, there is a fine line between, like, you can drink alcohol, but not become an alcoholic. And so where do you cross that line at? And I would just challenge you to ask yourself, does your weight keep you from doing things that you enjoy, keeping you from being with people that you love, keep you from living your best life and playing with your grandkids, or doing active things? Are you on the couch a lot? Those kind of things. If I define an addiction as anything that keeps me bound from doing what I want to do, that's an addiction to me. And so it may offend you, and that's okay. It's okay if it offends you a little bit, because that's where transformation can actually happen. When you become aware that maybe there is a solution, and maybe I don't have to put up with this. So yeah. So and you've probably been given wrong advice on how to lose weight in the past. I see that a lot too. So sometimes it's not for a lack of trying. There are people that are trying, they're just being given the wrong information. And I think that factors into, to their journey, right?
I like to think of what we do as coaches is we offer people tools, right?
Yeah.
And a tool is an instrument that helps make a job easier. So I might ask one of you guys, hey guys, can you put this nail in the wall, right? And all you could have is maybe a pen on you, and you might start whacking it with the pen. And this is the thing, is that you're going to eventually put that nail in the wall if you're willing and able to stay there for 3 or 4 hours to whack the thing into the wall. But the problem with you whacking it for 3 or 4 hours is that by the end of the first hour, by the end of the second hour, you might give up. And that's what ends up happening with a lot of people when they're trying to do it on their own, is that it's like they're whacking this nail with a pen, and it might work in 5-10 years, okay? But you're like, oh my goodness, I'm putting so much time and effort into this thing. Am I ever going to see any results? And so what we as coaches do is we come in and we give you a hammer. And with a hammer, you're going to whack that nail into the wall with 2 or 3 solid whacks, move on with your life. The question of, is it even possible, will never cross your mind, because you know it is, because you have the tools that made the job easier. And that's what we do as coaches. So if you have been whacking at a nail using a pen for years and years and years, I don't blame you for thinking that it's impossible. I don't blame you for wondering, could it ever happen? Okay. But I invite you to explore what it's like to work with a hammer, to use the tools that we have available. And I invite you to reach out to the person that shared this video with you, because what we want to do is we would love to share hope. That's what we're here for. So thank you for joining us. We would absolutely love to hear your thoughts on this topic. And we would also love to hear your thoughts on what topics you would like to hear us discuss. So with that said, have a good one, guys.